4 of Module 7 and 8 for Investigating Science. First, we're going to start with our do now. So I want you to attempt the inquiry question using this graphic here. So the inquiry question is, how do economic, social, and political influences affect scientific research? And looking at these factors that we see here in this diagram, see if you can attempt how each of these factors may influence research. So this is just the start of the inquiry questions that we're going to look at in this cycle. So we're looking at why scientific research is regulated, and then we're starting to look at the economic, social, and political influences that affect scientific research. So lots of the regulation of research links very closely to what we looked at in our last cycle in terms of the codes of conduct. And here we're looking at a lot of ethical issues, but also the regulations that we put in place. Again, we have 3 parts to our video looking at the regulating the research. We are then going to address the space exploration descriptor, and then we're going to look at economic development and human progress. So in terms of the meta language for this video, we're going to be looking at regulation and ethics. So the idea of regulation is that it is the set of rules adopted to enact legislative direction and authority. It's usually created by an expert, which can challenge the ideas held by governments and the public. And then ethics is a system of moral principles, and they affect how people make decisions and lead their lives. We're just going to quickly go back to our syllabus outcomes. You'll see here that I've highlighted the 4 examples. So this video will take us through each of the different examples that are outlined in the syllabus. But you are not required to know each of these in detail. You will be asked on some different ones, and it may ask a more open-ended question. So talk about an example of regulation of scientific research, and you can use one of these 5 descriptors here. So just be aware that you don't have to know everything in detail for these inquiry questions, because it does have the 4 example at the end of the descriptor. So the first that we're going to look at is in terms of genetic modification. So genetic modification is the process of altering genetic makeup. The idea of modifying sex cells and embryos will change the germline, which means that the changes will be introduced into the offspring, and then will keep on in further, lineages down the track. And then in terms of modifying these sex cells or embryos will result in a genetically modified organism. So in ancient times, this would have been influenced by selective breeding, but the example which we see here is in fact the CRISPR technology that is very prominent in scientific research, and it is harnessing the Cas9 enzyme here, and the idea that if we can manipulate something that bacteria already has in terms of the ability to cut up different genomic sequences, we may in fact be able to delete or insert genes to change different DNA, which will result in genetically modified organisms. This may or may not be to improve human health. So sometimes it could be for, personal preference, but we're looking at the use of the CRISPR technology to, in fact, delete sequences of genomes which would cause diseases like cancer and other genetic diseases that we see in our population. So we're going to read an article here about a professor from China that has used the CRISPR technology to intentionally modified genomes, resulting in twins Lulu and Nana. So looking at the idea of whether that is ethical or unethical. And then we're going to assess using the assess scaffold here. The ethical issues and regulation surrounding gene modification and gene manipulation. It will be important here to bring in the gene technology regulation and codes of conduct that we've discussed previously. The next is the idea of the development of biotechnological weaponry. So the idea that there have been rapid developments in this area, resulting in different challenges for advanced societies. So there are very severe implications if this technology and weaponry is used incorrectly for international peace and security. However, there is also not just the weaponry in terms of technology, the genetic engineering of superbugs is something that is also a challenge for us moving forward. And the fact that there are some countries around the world that could use these weapons in different kinds of operations and activities in the future is quite a scary place to be in. However, to prevent the exploitation of biology in terms of developing biological weapons, it is in the Biological and Toxin Weapons Convention, which is outlined by the World Health Organization. It builds awareness in the regulation that is put in place for people who have signed up to the convention. That we are aware of the ways it could be used, but people who've signed the convention are agreeing that it will not be used in that way currently. So any kind of research into this area must be performed in an internationally transparent and controlled manner. So there is a video here from the United Nations looking at the regulations that is in place and in terms of the use of the biological weapon and signing up to the convention. There is a treaty that they mention here that would be important to use in terms of the way it regulated its research, which I've elaborated on in the previous slide. So pause this video and watch this video from the United Nations that will give us some information to be able to answer again the scaffold here, looking at how we would regulate research in terms of biotechnological weaponry. The next got to do with research and ethical issues in the pharmaceutical research and testing. So in Australia, all pharmaceutical goods are regulated by the TGA, so the Therapeutic Goods Administration, and their most recent act is the 1989 version. So looking at making sure that anything that is put out into society has undergone a wide range of testing for its quality, its safety, its efficacy, and making sure that is available for people if it is going to improve health. And making sure that it is part of the process in terms of making sure the products are definitely safe and reliable for consumers, and undergoing the pharmaceutical analysis to ensure it meets regulatory and quality requirements. There is a World Health Organization policy here looking at why medicines would be regulated and why it is important that they are licensed and that their safety is assessed to ensure, global safety. So, in terms of ethical issues, lots that are reported in terms of this has got to do with the pricing, the disclosure of data, how they are designed in terms of their clinical studies. There are issues related to vaccines and the growth of drug counterfeiting. And then I guess the idea of pharmaceutical fraud. So a lot of ethical issues that surrounds pharmaceutical research and testing. It is kind of regulated by these three circles here. So the responsibility of a pharmacist here is discussed in terms of prescribing these to a patient, making sure that the health and well-being of the patient is the priority and not just to sell drugs and make money from drug companies, making sure that they're honest, but also making sure that they're working collaboratively to ensure that they are able to deliver the best care to optimize health outcomes. So there is a rigorous reading activity here to make sure we're looking at how the National Measurement Institute is being used in Australia in relation to the TGA. And again, we're going to assess the ethical issues using a table here. And there's also a different summary for the way that you might have your ideas set out in terms of outlining the positives and negatives in terms of regulating and the ethical issues that are apparent there. The next is the nuclear industry and the use of radiation. So, in terms of regulation, there's the Australian Radiation Protection and Nuclear Safety Regulations that was outlined in 2018. And then there's the Non-Proliferation Treaty, which is the agreement between countries to not manufacture nuclear weapons, but being able to use nuclear technology for health reasons. In terms of ethics, there's the International Commission on Radiological Protection, and that there are 4 core values that it looks at in the use of radiation in terms of medicine. So making sure that there is a large amount of transparency here in the way in which we suggest radiation treatment, but also use it in society. The next is the idea of bioprospecting. So it's conducting tests to determine whether an organism could be used to manufacture a product, and looking at some really ethical issues in terms of how much is taken from an ecosystem, what should happen if something is found in Antarctica that are controlled by multiple stakeholders. Bioprospecting involves a lot of stakeholders due to the fact that there are a lot of bioprospecting happening with Indigenous communities, especially in Australia. So it is really important that when we look at bioprospecting, we're not just looking at what implications it has for human health, but how we can also, be culturally aware of the way that we work with traditional owners of the land, and don't just take it for, product benefit. So making sure there is down here in terms of working with traditional owners for traditional medicines and native plants, making sure that permissions are sought, that there's equal benefit sharing in terms of resources and intellectual property, and making sure that there isn't a possibility for traditional owners to work with researchers to really understand all of the different perspectives when we look at bioprospecting. In terms of the process, there's 7 steps here. So the idea of that the compound of interest is identified, samples are collected, they screen for bioactivity, isolate the compound, confirm its bioactivity, and then they go into the development and manufacture for commercialization. So some examples is the opium poppy giving us morphine, the white willow tree helped to develop aspirin, and then the idea that the spoiled sweet clover gave rise to the anticoagulant warfarin, which is used by people with heart issues. In terms of the intellectual property we have here, it is quite unethical for businesses to exploit communities. So there are a large number of regulations established to protect Indigenous intellectual and cultural property. The property always remains under the ownership of the traditional custodians, and it takes into consideration a large amount of things, not just the medicinal plants and animals, but also anything that is on the land that is of significance to the traditional owners. So recognizing this is at the heart of reconciliation. So it's really important that we understand the reasons why it's important to protect intellectual property, and making sure that everything proceeds on the basis of respect, informed consent, negotiation, attribution, and the sharing of benefits. So there are a couple of questions, and again, our assess scaffold here to look at bioprospecting in detail. Pause the video now to complete task 5. The next has got to do with mining. So there's quite a lot of ethical issues that apply when we look at mining. So not just looking at what we are taking in terms of what we are trying to mine, but making sure that there's a plan for rehabilitation, the impact on the local community. Is there a lasting impact? So we can see here quite a process of how we may, in fact, grant some exploration licenses. So this is a process here, and it involves a lot of consultation with traditional owners of the land and looking at then all of the different issues for that community of and around mining. So again, task 6 allows us to elaborate on this and looking at the ethical issues in more detail. You may want to go back to this diagram in more detail, but also consider these probing questions in your research. The next, we have space exploration versus investments in social issues. So in terms of looking at space exploration, it has the potential to solve a lot of our current issues. It's important for the future. There is a quite of application of principles of physics that can be investigated. It can be used to boost the economy if space travel ever becomes a possibility, but also just the increasing of scientific knowledge itself is a valuable resource. So investing in space exploration, something that the government is responsible for. These are all the examples that are positive, why we would want to go and explore space. However, there is an argument that this funding should be invested in social issues. And this is where our against argument is formed. So scientists could be using their expertise to solve more pressing issues like poverty and hunger, that we should take the precedence on our current planet to understand all the different things that happen, because there's so much of it that we haven't explored yet. There has not been any direct benefits of space travel, that most people don't actually see the benefit of space-related inventions in their everyday life, and that there is an argument that the money invested in space exploration is just to show off, part of a competition that between countries that exist. So in Australia, we do have our Australian Space Agency. So in Australia in 2020, $19.5 million was invested to grow the space sector. So we can see here where the money would be allocated. So in that budget, there is no money dedicated specifically to domestic violence services. And there was only $1 million to trial a program for young people at risk of homelessness. So in terms of if we're looking at different social issues that we could invest our money in rather than space, there are definitely a lot that come to mind that we could invest in. There is the argument, though, that even just $19.5 million, that it may not be enough even to keep up with places like NASA, what would the Australian Space Agency be able to develop with $19.5 million? The argument is that even not enough money. So there is different sides to this argument, and this is very much a topic that is great to debate in your classroom, looking at both the different sides of this argument. So pause this video now and undertake the activity. There is an activity, a bit of a budget game, to decide how if you were in charge of the budget, how would you allocate your money? So pause the video now and complete that task. The next, we have the idea of nuclear power generation. So the idea that Australia doesn't have any nuclear or plans to create any nuclear energy in its, its site, that we are one of the highest consumers of electricity, but no plans to generate nuclear power, even though all of these dot points here indicate to us all the positive parts of it. The next we have to do with the use of antimicrobial drugs, and the idea that, again, we don't have to know all of these examples, but we're starting here with nuclear power generation, which is our third part of this cycle. The next has got to do with the ethical uses of antimicrobial drugs. So the idea that it is declared as one of the top 10 global public health threats, and it requires a lot of action if we wanted to achieve the sustainable development goals. There's quite a lot of costs related to it in terms of death and disability and prolonged illness. However, without effective antimicrobials, there's quite a lot of risks associated with different surgeries that are quite common in our society. It does require greater innovation and investments, and the development of different drugs to ensure that we don't have antimicrobial resistance as a big issue. The next has got to do with genetically modified foods. So the idea that if we developed these, it may reduce the resistance to plant diseases and increased tolerance to herbicides, which can reduce for food prices and improve yield and reliability of our food sources. And it could be aimed at altering the nutrient content of food. So all of these foods have to be labeled as genetically modified foods, which one of the examples here is golden rice, where vitamin A was actually put into rice so that third world countries could combat vitamin A deficiency by having golden rice crops in their society. There's the ethical issues around the use of petroleum products. So there's some examples here of how they would be used around our house, and whether they would in fact be helpful for us moving forward and using these. And then there's the idea of robotics and the use of drones. And especially here, we see them being used in improving beach safety and to gather data on shark behaviors. Robotic devices enable surgeons to operate remotely. So it may be something moving forward that will be quite a issue that we would need to discuss in terms of whether they would in fact be more suitable in going forward for how we would use these in our society. So this concludes our cycle 4. There are 2 inquiry questions for this module, and make sure you answer the Google form, which has a few different HSC questions. And if we just go back to our inquiry questions here, we're looking at the regulations, the ethical issues, and then our last section, which started with nuclear power generation, in terms of how research into these areas will improve our economic development and human progress.